All right, so, okay, I think we'll begin by saluting to the flag. I was like, Supervisor Bono always kind of throws me a little bit off. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. All right, so we'll begin asking if there's any modifications to the agenda.
Thank you, Chair Bass. There are no modifications to the agenda today.
All right, thank you. Is there a motion to approve the consent calendar?
So moved.
Second.
All right, we have a motion and a second. We do have several items. Anyone have any comments they wish to make before we go to public comment from the board? All right. Well, before we go to public comment, I do want to read a retirement resolution into the record. I see we have Kathy out there with us, and then we'll have you speak under the public comment period. So resolution of the Board of Supervisors, County of Humboldt. Whereas Kathy Rigby was hired as a program manager for the Humboldt County Department of Health and Human Services, Training, Education, and Supervision Unit in March 2009. Whereas in 2018, Kathy transferred to Behavioral Health's Quality Improvement Team and became the Mental Health Services Act Coordinator and Ethnic Services Manager. And whereas Kathy, known by coworkers around behavioral health as an awesome employee who has taken the lead in incredibly important areas. And whereas Kathy's supervisor said she has always been fully engaged in her work as MHSA coordinator and has been an amazing steward of the MHSA funds, ensuring that all rules, regulations, and requirements are consistently met and that community and stakeholder input is included and recognized. And whereas she has moved the work of racial and cultural equity forward in the behavioral health branch and across DHHS in her role as the Ethnic Services Manager. And whereas Kathy is humble, kind, smart, and incredibly reliable and will be missed by coworkers and the community alike. Now, therefore, be it resolved that the Humboldt County Board of Supervisors hereby recognizes, honors, and expresses gratitude for Kathy Rigby's years of dedication to the county and wishes her a long and happy retirement. So we did want to read that into the record. It's always hard when very dedicated, valued employees retire. And we will hand this to you in just a few moments after the public comment. So at this point, we will go to public comment. If you are listening on the phone and you wish to comment on items on the consent calendar, you should press *9 now and raise your hand. We will go to those in the audience first. So again, if you are listening and you plan to speak on the public comment period, it's really important to press *9. Also turn the volume feed off of your video because there's a time delay, and if you don't do that, you could miss your opportunity to speak. So I think we'll start with Emmy under our public comment periods. Thank you. Welcome, Emmy.
Hi, good morning. Emmy Botzler-Rogers, Behavioral Health Director. I wanted to just comment on the resolution for Kathy Rigby's retirement. She has been an amazing employee. She's been with the county for 13 years and most recently the last several years working on MHSA coordination and ethnic services manager. And I just want to say that Kathy is one of those employees who is not about getting attention or recognition. She does her work behind the scenes and she does it really, really well, which is I'm so grateful for. I'm appreciative because she really has kind of brought MHSA online in a way that we hadn't had it previously. I mean, it's such an important initiative and she's really kind of embraced it and made sure that we're fully compliant and fully engaged with stakeholders. Equally important, she has moved the work of equity forward in our branch and in DHHS in ways that we haven't done previously. So I'm so grateful for that as well. So I will miss her. I'm glad for her retirement for her, not for us. And thank you very much for the recognition.
All right. Thank you, Emmy. All right. Welcome.
Good morning. I wanted to speak for Kathy Rigby. Emmy and the resolution said some of what I wanted to say. She is humble, kind, smart, and extremely reliable. And she does a lot of work behind the scenes without flash or show. She is always going to do her homework. She is always going to be prepared. She is always going to have read the material and produced a lot of work. And folks like that are so valuable. She'll be very, very, very missed. She has done a lot of hard, heavy lifting at DHHS. One thing she is partly responsible for is the introduction to DHHS orientation we have for all of our new employees. That is a wonderful orientation, and she wrote an outline very early on and helped move that forward. And you may not be credited, but I know it's you, Kathy. Thank you.
Thank you. All right. Welcome, Kathy.
Thank you. I'm just here to say thank you very much to everyone in the county. I've been very, very grateful to have had this position, and especially to have been working in behavioral health for the last few years. There's some wonderful people in behavioral health working really hard to try to meet an almost unmeetable need for behavioral health services. So thank you so much for the resolution and for the very, very kind words that I've heard from my colleagues. Thank you.
Well, thank you, Kathy. Kent, welcome back.
Ken Swatsky, I brought something for you, and it has to do with all my topics up here. This is karma. I'll explain maybe. 1:30, we have public comment at 1:30, I guess. Should be a quick one. Anyway, I guess I'll come back. I did wish to speak a little bit on item 7. It's the ratification of the separation agreement with Auditor Controller Karen Paz Dominguez. I've always appreciated Cheryl. I'm glad Cheryl is on board with you. Sounds like maybe your other new person that you got out of from down south that you poached up there is helping her, maybe as far as assistant auditor controller, because my understanding is Cheryl can't come on board right away. She's got other duties to do for a while, so you'll be working there. Regarding this particular settlement, I think you were very lucky at this time to have this settlement. My understanding there's still ability to litigate this. I will stand with my comments before regarding this particular topic, that there was improper use of county staff and county facilities to cause this election to go in the direction it did. Of course, that will be dealt with in the future here. And I really strongly suggest that when it comes to this particular one or other ones, that you don't participate in these elections using your staff time and your facilities. I feel personally that if I were in her position, I would be coming forward now and asking for 4 years worth of pay. And in my position, my recommendation would be to grant her that, because in my opinion, the alternative is that some of you may be doing at least 1 year of minimal time in a prison, because it's a felony, what would happen there. And I did speak with some quite competent legal counsels, including I have access to some of your prior county counsels, and you might find you're in that particular position. You may wish to get a little bit more advice as far as what transpired here. So thank you for the opportunity to speak on that one. We had a couple other things on here. Looks like the meeting's going to move along quite rapidly. I get a chance to speak, I guess, at 1:30, so I guess we all come back at 1:30. Maybe in the future, if we have such a short agenda, which this may be, have an option there of either having it here or there, and then maybe we could not all have to come back at 1:30. Thank you for the opportunity to speak.
All right, thank you. Anyone else in the audience care to comment on this item on the consent calendar? We'll go to those on the public first. That's right. Anyone who's online? And do we have any speakers under the general public comment period?
We do, Chair Bass. We have the caller 0116.
All right, it's not showing up on my view speaker slide, so, but thank you, 0116. Welcome, Ash. Are you there?
Hello, can you hear me?
Yes, welcome.
Okay, yes, Ash Teeter. I'm speaking on number 14 on the consent calendar, the agreement with the CDPH regarding disease intervention workforce activities. Recently, New York just reinstated its mask mandate after the 6th wave of COVID hit the almost fully jabbed city. I want to go over a few things in case, locally we get the marching orders to close down small businesses again or force masks on the community once more. We're living in a captured operation. U.S. televised news is the second most untrusted organization in the country, only followed by our government itself. Dr. Fauci's net worth exceeds $8 million. According to financial records made public in January, his wife's assets bring their total to $10.4 million. Fauci has served with the American public health sector in various capacities for more than 50 years and has acted as an advisor to a U.S. president since Ronald Reagan. A new Israeli study found that COVID boosters significantly delay the end of an infection. Emails confirmed why the CDC had changed the definition of vaccine and vaccinated. That was another story headline that came out. Pfizer recently asked whistleblowers lawsuits because the government was aware of fraud. And also a judge, well, that's it for me, duty calls. But anyways, just think about all this next time you're asked to go along with any silly plans, put forth by the state or federal ridiculous clowns that are running the show. Bye.
All right, thank you. Do you have any other speakers that are not showing on my list? All right.
No, Madam Chair, we don't.
All right, we will go back to the board. Supervisor Madrone.
Thank you, Chair. I just wanted to thank Kathy also for her service. I had the pleasure of working with her a fair amount at the Behavioral Health Board. And Kathy, it is going to be hard to replace you. But you've set a lot of systems in place and standards which will help us continue the great work that you've done. And I want to thank you for that. You brought a lot of compassion and care to the work. I was amazed at the outreach and community engagement that you brought to the process. So thank you for all your hard work and very much wish you a wonderful retirement.
Very nice words, Supervisor Madrone. Anyone else? Supervisor Wilson?
Just echoing all those sentiments with relationship to Kathy, but I want to emphasize, whenever someone's sort of having to trailblaze in a organization and really make the changes up front, there's a lot of challenges in there, and to stay with it and work as long as you did to make those changes, and then also to have the praise related to that is a real accomplishment, and I really appreciate it. Thanks.
All right, thank you. Supervisor Bushnell? I almost called you Michelle. Well, you are Michelle, but Bushnell?
Thank you. I haven't had the opportunity to work with you, but anybody that does this work is it's commendable. It's tough work. It touches a lot of people, and congratulations on your retirement, and thank you for working for our county for so long and so diligently.
All right, thank you. Supervisor Bone?
Ditto.
And I do believe the resolution was passed down, and did it get handed to Connie? Okay, so it'll be coming to you in just a few moments, Kathy. All right, thank you all. So I think we are ready to vote.
For the record, my I legislate just doesn't connect, so.
Okay. Oh. I will go ahead and do roll call then. Supervisor Madrone?
Yes.
Supervisor Bass?
Yes.
Supervisor Wilson?
Yes.
Supervisor Bushnell?
Yes.
And Supervisor Bone?
Yep.
Thank you. Motion passes 5-0.
All right. Thank you very much. So we have a 9:15 time set, so pretty close. This one comes to us from the County Administrative Office, and it's about County Medical Services Program presentation, CMSP, otherwise known as. So.
Hi, yeah, thank you, Chair Bass. In the panel on Zoom is Carrie and Allison, who are both come to us with CMSP to provide a presentation. So, Nikki, if you could pull that up, and I will toss it over to them virtually to present to your board.
Thank you.
Through the chair.
Good morning.
Alicia.
Allison can also pull up the PowerPoint if you would like, if we don't get it up there in a second.
I think that would be great. Thank you. Please
Okay,
do.
Allison, you want to go ahead? Thank you. All right. So thank you for having us this morning. My name is Carrie Brownstein. I am the Executive Director at the County Medical Services Program Governing Board, and I am joined today by Allison Kellen, our Program Director. Next slide. Today, we're just going to go quickly a little bit of CMSP background, talk to you about our counties, our board members, our benefit programs, grant programs, financing, and some resources. Next slide. Okay, so now let's just talk a little bit about the CMSP background. Some of you may be familiar, but some of you may not. We're a smaller program since ACA, so you might not be aware. But just a little bit of background. In '82, California law eliminated Medi-Cal eligibility for the medically indigent adults, and they became the responsibility of the counties under Section 17,000. CMSP was created in '83 to address the needs of the smaller counties. So it was a pooled risk health benefit program. Eligible counties had 300,000 or less in the base year 1980, and we have 35 participating counties. In '95, the governing board was established. The governing board is charged with overall policy and fiscal responsibility for CMSP. It is made up of 10 county officials, which we'll go over in a minute, and 1 ex officio non-voting state rep. Following the Affordable Care Act, so we were a much larger, CMSP was a much larger program as far as members in the CMSP program prior to ACA. And you might be familiar with ACA and what happened with the Affordable Care Act is a lot of the medically indigent went back to Medi-Cal. So 138% of the federal poverty level and less went back to Medi-Cal. So we had a significant decrease to our CMSP membership. And that's when the governing board got together, did some strategic planning, and we created the Path to Health program, Connect to Care, and we also launched additional grant programs. We have a small office here in Sacramento, and we are administered through lots of different contracts. One is Advanced Medical Management. They do our medical and dental benefit administration. MedImpact does our pharmacy benefit administration. We work with the California Department of Healthcare Services for CMSP eligibility, and Illuma for the Path to Health and Connected Care eligibility. And we also have several other consultants and contractors that provide various services. Next slide. Let's show you our counties. So here you have the 35 counties within CMSP. So you see we're mostly Northern California, got a little Eastern, and then we have Imperial down there in the South. Next slide. Governing board members. All right, here are our governing board members. They are made up of 3 supervisors, 3 CAOs, 2 health directors, and 2 welfare directors, and again, that ex officio representative from the California Health and Human Services Agency. You're gonna see a familiar name here. Alicia recently joined us as a board member from Humboldt County, and we have had Humboldt County representatives on our board in the past as well. Our chair is Brad Wagon Connect out of Napa County. And we also have Richard Forrester from Amador County. They have both been on the board for several years. Oscar recently joined us. We have Richard Egan from Lassen County, and we have Humboldt County, Marin County, Colusa, Madera, Yuba, and Glenn. Next slide. All right, we also have committees. So we have 3 committees. Our executive committee is made up of our board members, and the executive committee might see things in between board meetings if something comes up, or if there's something that needs to be studied, or a little bit more, something in more detail needs to go into. And those members, you can see there, Alicia from your county is one of our executive committee members. Then we have our planning and benefits committee and our eligibility committee. Planning and Benefits Committee, what they do is they're going to actually meet later this summer, late August, and the CMSP Governing Board is going to be doing some more strategic planning, and that starts with our Planning and Benefits Committee. And Eligibility Committee goes into the eligibility of our members. Next slide. CMSP benefit programs. I'm going to turn it over to Allison to talk to you about our 3 benefit programs.
Right, I'll just leave this slide up as a reference. It is a comparison of our 3 programs. We have our original County Medical Services Program, which was our program that started back when Carrie spoke to the beginning of the board, and then our Path to Health and our Connect to Care programs. And I'll go into each of those. CMSP, to be eligible for CMSP, you need to be a resident of one of the 35 CMSP counties. Our county social services departments enroll individuals into CMSP. I'd like to point out Laurel Johnson has been on the eligibility committee for many, many years. It's been a very valuable resource to us at CMSP. Individuals need to have incomes between 139% and 300% of the federal poverty level. The federal poverty level is a calculation of someone's income, but it also takes into account their household size. And they need to be not eligible for any other type of publicly sponsored program like Medi-Cal. Our benefits include full scope benefits for legal residents, and we have emergency services only benefits for anyone who is undocumented. But we do provide no cost primary care services for all enrollees, and that includes $5 prescription medications. Some of our contracted providers within the county include Mad River in Arcata, Jared Phelps in Garberville, and then Open Door Community Health Centers has been a longtime supporter of CMSP and a very valuable partner to us. Overall, statewide, our enrollment is under 800 members, and we have over 40 members in Humboldt County. Up next, we have the Path to Health program, which is the board's effort to provide additional access points for community members to receive services. So this program provides primary care services to undocumented adults from 26 through 49. Undocumented adults in California 50 years and over starting in May are covered under full scope Medi-Cal coverage. We use clinics to help enroll individuals into Path to Health. They use a system called the 1E app system. We have about 22 health centers, organizations statewide that assist with this enrollment. Open Door in Humboldt County is doing this enrollment, and they've got 10 service centers. And we have a little over 100 members enrolled in Path to Health from Humboldt County. Up next, we have our newest program, which is Connect Care. This program is for documented and undocumented adults who are earning over the income level for Medi-Cal, for the modified adjusted gross MAGI Medi-Cal. And they have no other existing health services coverage. And there's no private insurance, not eligible for Medicare, not eligible for Medi-Cal. So the clinics also using the system to enroll into this program. Open Door is providing that enrollment for us within Humboldt County. They currently, they're getting up almost to 20 members, which is great. So kind of a 1-by-2 effort. We are launching a media marketing campaign within Humboldt County, so you will start to see some bus ads operating in your county, as well as Cartella displays in front of some of the grocery stores and convenience stores in the county. Here's a list of the participating enrollment clinics. So we have got, most of the clinics are participating in both programs. We have some that are just doing Connect Care and some that are just doing Path to Health. But as I mentioned, Open Door is doing both programs for us. I'll turn back over to Carrie.
All right, I'm going to quickly go over some of our grant programs that we currently have. One is our local indigent care needs grants. That is, the board allocated $50 million to be released through this grant program. To date, there are 22, we've awarded 22 planning grants and 27 implementation grants. Those planning grants are $50,000 to $75,000, $75,000 if it's more than one CMSP county, and implementation grants up to $1.5 million. They focus on local level care management, continuity of care, enabling services, disease management. And in Humboldt County, we had 2 planning grants. And then one of those planning grants became an implementation grant. And that's the DHHS Public Health. And they were awarded the implementation grant of $1.5 million. And with that, they're strengthening the mechanisms for disease management of chronic hepatitis C through increased testing, treatment, and care coordination. Next slide. We also have, we called our CERG grant, COVID-19 Emergency Response Grant. So when COVID-19 in March 2020, when that happened, the board quickly got together and formed a grant program for our counties for looking at personal protective equipment, quarantine services, engaging public employees, engaging nonprofit human services, conducting public education. And Humboldt County was awarded $367,000 grant through this program. This project served 288 individuals, and it included temporary shelter, hand washing stations, portable toilets, and wraparound services. Next slide. Next one we have is our Health Systems Development Grant Program. This one focused on expanding access to care for primary care, specialty care, behavioral services, coordinating or integrating health and behavioral health care services, strengthening the overall healthcare delivery system. Humboldt County DHHS Public Health was awarded $300,000, and this what this one did is expand access to care, especially for hepatitis C prevention, testing, and treatment. Next slide. We also have a Specialty Care Access Grant. That's a special grant we do through an organization called Operation Access. It's a 5-year grant totaling $5.7 million, and it goes across various counties. Services are available in 12 CMSP counties in 2021, and they're doing additional 7 counties, including Humboldt, in 22 to 24. What this does is it expands specialty care for low-income, uninsured, unfunded adults by arranging elective outpatient procedures through donated care. Next slide. We also have a healthcare workforce development program. So we partner with formerly OSHPD, now HCAI. We have 2 loan repayment programs available to providers in our CMSP counties. We have the CMSP loan repayment program, which with amounts up to $50,000 for a 2-year service obligation in one of our contracted providers, and our allied healthcare loan repayment program, which is up to $16,000 with a 1-year service obligation. To date, 19 providers in Humboldt County have received awards totaling $571,000. What professions, you might wonder? We have a clinical laboratory scientist, dentist, family medicine, doctor, health educator, medical assistant, nurse practitioner, physician assistant. Next slide. Just before I go on to CMSP financing, just wanted to give you, let's add up all those numbers for your grant programs, just to give you an idea. Our current grant programs add up to about a little under $3 million for Humboldt County. CMSP financing, you might wonder about how is CMSP financed. So we have 2 different tracks here, so to speak. Pre-Affordable Care Act, we were financed through county realignment. CMSP had their own realignment and county participation fees. Post-Affordable Care Act, county realignment was directed to the state. One thing to note there is that the county realignment was capped at the pre-ACA CMSP amount established in 1983. Our own realignment was significantly reduced through 1819, and our realignment was postponed in 1920 until our CMSP reserves are reduced to 2 years of operating costs. Also, county participation fees have been waived every year since ACA. Next slide. All right, I'm going to give you a few resources. Myself and Allison and our Director of Finance Administration, Megan Forrest, are good resources. If you have any questions, here also, just through this on the slide here, you can see what you might be seeing in your community. This is an example of a poster that you might see in your county referring to Path to Health, Connect to Care, and CMSP. Next slide. And we also have 3 websites. We have our main website, cmspcounties.org, but then we also have a website for Path to Health and Connect to Care. For easy reference, you can go to careandreach.org for access to all 3 programs and get you to all of our websites. All right, any questions? I'd like to open it up to questions. Thank you again for having us. And we're available for any questions now or at a later time.
All right, thank you. Any board members? Supervisor Bone?
And I think our CAO answered this, but I know we did not have any participants in CMSP for a few years with Obamacare coming online and stuff now. Are those numbers picking up with are they considered and then how many people? I know the county leads the state in Hep C, but there's 1.8 million to Hep C. And I'm wondering what kind of headway we're making on that.
For the enrollment, yes, there was a period of time where enrollment was very low. We have seen an uptick recently, which can in some ways be attributed to COVID. But it is good to see that this program is being more heavily used within our community. I am not a Hep C expert, so I'm going to look at Connie over here to see if she can respond to that.
And I just see a big part of its education, and I don't see a lot of flyers or we're having a Hep C meeting or anything like that. So I don't know how, and I know Hep C now has a treatable, but it's like $89,000 or something. And I don't know, are we actually treating people with $89,000 treatments?
Not public health, but we are connecting people via case management. We've hired staff through the grant to help people navigate to providers. We've partnered with Open Door. Public Health started a hepatitis C coalition to have all the folks that are involved in hepatitis C identification, testing, and treatment to link people to providers. Part of the problem that we had here in Humboldt is that we didn't have enough providers that were trained in treating hepatitis C, and so we had a whole initiative where we had several providers from Open Door and other organizations like UAHS attend a training in order to be able to treat hepatitis C. And so that has increased. So, but in terms of treatment, they can access treatment. It's not as expensive as that. I believe Medi-Cal covers more now than they did before, but I'd have to double check. It's been a while since I've been actively involved.
Through the chair, how many, and I know we're top in the state, or we're, we get we get all the good
Which
ratings.
is why we asked for the grant.
Yeah, no, I fully understand, but how many people do we have with Hep C?
You mean currently right now in Humboldt County with hepatitis C? I don't know off the top of my head. I haven't looked at those numbers in a while. But we do have
I'm just
the
wondering
highest.
if I'm trying to figure out, are we having any success, or?
I don't know off the top of my head. I'd have to look into it for you, Supervisor Bone.
That'd be great.
Yeah, I can do that. And we can also do a presentation for you all on the program that we have and the staff that we're doing that work.
Because I know we're spending other money with 1.8 million. I'd like it just be to see what kind of progress we're making.
You might remember that we came and did a presentation on hepatitis C rates in Humboldt County, I don't know, pre-COVID, so it's all a blur. But we can give an update on that in terms of what we were trying to do with addressing that, because we didn't have the staffing to link people to care for case management. So yeah, we can.
I think an email would suffice. I don't know if we need a presentation.
Okay.
Yeah.
Whatever works.
It's just, that's a curiosity thing. Because we hear the numbers, but we don't see the numbers. So it'd be great to, and we're spending a lot of money, so.
Yeah. The 1.5 is over 3 years, so it funds like one staff person, basically. Yeah. 2 people probably, I think, a health education specialist to do the case management, I think is what that grant covers. And then I can't remember what the other one does. I'd have to look into that too.
Yeah, there's like 1.8 million total going towards it. So I hope that's more than one staff person.
Well, yeah, but over 3 years, it doesn't go that far with salaries and benefits and whatnot. So insurance,
All right, thank you. Supervisor Wilson?
No, there's just a request that if there are materials that you want us to be distributing through social media and other things, if you could send an email with those links, that'd be awesome.
Sure, happy to.
All right, thank you. Any other questions for staff there? Any other questions from the board? Comments? Okay, if you're on the phone and you wish to make a comment on this item, be sure to press *9 now. We will go to those who are in public first. And welcome.
Ken Sawatsky, I appreciate the questions asked by Supervisor Bone. I'd like to not just have you guys get an email, but if there's some way that information could be provided through this process at a meeting. I don't know, if something on consent, a little attachment says we got the email or something, that'd be appreciated. The math wasn't checking out there. 1.5 million for 3 years is 500,000. In my experience, most of your people you can get for 75,000. So I wasn't understanding how that money's being spent. The other clarification is a kind of a follow-up question on what Supervisor Bone asked Alicia regarding what kind of participation, and she says it's an uptick or something. I appreciate through the chair, and I don't know whether you would like the answer also, as far as how much that uptick is. I mean, is it 2 people? Is it $30,000? Or where that money's going? So that's a question that I would like to leave with this. The final question I have here and I guess this could be for Alicia or the staff that was speaking on there. If we go to a single payer in California, is this one of those programs that are kind of wrapped up into single payer, and does this whole thing particularly go away? I mean, my understanding single payer is supposed to cover everybody for everything to a degree, and that's a question we've asked before as far as single payer and the county's cost for all kinds of medical things, which is, as we know, extremely expensive. So that's just a question that through the chair I would like to see if somebody could answer whether single payer would be anticipated possibly or probably, and what the odds are to go ahead and wrap this into one single payer ball. Thank you for the opportunity to ask these questions and speak.
All right, thank you. And I see no one else in the public who are with us today, so we do have one online. Just a reminder, this is about the CMSP program, which is about coverage, and it's not about specific diseases necessarily or recent activities regarding, let's just say this is not the time to talk all about something called COVID. Yeah, so just like talk about CMSP and the coverage would be most welcome. Thank you very much. And so we at least have one hand up, and that's 0116.
Hello, can you hear me?
Yes, welcome, Ash.
Yeah, I just wanted to ask another question. I don't know if it's been considered with what was being talked about with the Hep C. Is I know, like, if I recall, like the needle exchange program, wasn't that like originally introduced to like lessen Hep C in the community? You know, other transmissible diseases and stuff. I just wonder if there's been any like studies to see if it's been lowered since like Hatcher has been in action in our community. If there's any kind of positive results from that, other than the vast needle litter we see from it. That's it. Thank you.
All right, thank you. And anyone else online? Nikki, I don't see any. All right, we'll come back to the board. And let's see, one of the speakers asked regarding an update coming, or at least something just saying that the information was received. Is that something we can, what would you suggest, Ms. Hayes? Or just, Mr. Sawatsky asked, he just wanted to know where he could get information about this thing. So can we just have something we can send to people who may be interested in this presentation, basically?
Sure, it's available through the Public Records Request Act.
Okay.
As needed.
Okay, all right. Well, thank you very much. Supervisor Madrone?
I would move that we accept the presentation and thank staff as well as those at the state for being here today to present to us.
Second.
All right, any other comments from the board? Supervisor Bone?
I want to thank our CAO for stepping up to serve on this board. It's like the 98% of the board is RCRC counties, so what it does, and it's a rural-based program, which these little bits and pieces that help us with our health issues, as in Hep C and other things, it's pretty advantageous. So I appreciate you stepping up. Not that you don't have enough on your plate already, but thanks for doing that.
Supervisor Wilson?
Yeah, and just to clarify, I'm just looking for those, social media posts that will be helpful in spreading the word for eligibility, and, just how do we get more people aware and connected? That's really all I really want to make sure happens. I just really appreciate all the effort in all this, because I do know people who have suffered from hepatitis A, B, and C in my lifetime, and so anything we can do to reduce those numbers is great. And I really, and these are long-standing and chronic issues that we need to deal with. So I appreciate the efforts.
Okay, so we have a motion that's been seconded, and we have everyone have the vote tab up?
No.
So we'll have to figure that out during the closed session break, perhaps. We'll do a roll call vote.
Yep. Supervisor Bone?
Yes.
Supervisor Bushnell?
Yes.
Supervisor Wilson?
Yes.
Supervisor Bass?
Yes.
And Supervisor Madrone?
Yes.
Thank you. Motion passes 5-0.
All right, thank you. And so now we'll move on to our 9:30 time set, which is a little delayed. And it does come to us from Planning and Building, and it's an update of the Nordic Aquafarms project. Welcome, Director Ford.
Thank you, Chair Bass. John Ford with the Planning and Building Department. If I could share my screen. I want to give you a bit of an update on the Nordic Aquafarms project, which is coming to a place where it will be in the public hearing process. And it There it is.
Nice, thank you.
Sorry about that. And it has been in the news with a change in leadership, and just wanted to briefly address that this morning too. For those that may not be aware, the Nordic Aquafarms is an aquaculture facility that will be located where the old Samoa pulp mill is. It will be a land-based aquaculture facility, and we have prepared an EIR for it, and the EIR went out for public review. We received a lot of comments on it, and we have responded to those comments. We prepared a final EIR, and that is currently available for review. If people would like to see the final EIR, they can find that on the County Planning and Building Department website. We are also moving towards a Planning Commission hearing, which is scheduled on July 28th of 2022. And so that will be a special meeting. That's this item will be the only item on that agenda. Just wanted to talk a little bit about the EIR because it is complicated and some people do get confused by it. The things that complicate it are the fact that there are two applicants. There is the Nordic Corporation, which has the land-based portion of the facility, and then there's also the Harbor District, which is permitting the water intake, and then there's also the outfall. So then that permitting is done by the county for the basic aquaculture facility, and then the Coastal Commission will be permitting both the intake and the outfall, in addition to permitting that's done by the Regional Water Quality Control Board and also the California Department of Fish and Wildlife. We have coordinated with the state agencies, have worked well. We think we've addressed their comments and their concerns. And we look forward to continuing to work through the permitting process as part of the environmental work that's been done. Also wanted to point out that we have consulted with the tribes through both informal consultation and formal AB 52 consultation. We've held government-to-government consultation with the Yurok, the Wiyot, and also Bear River. We've also received correspondence from Blue Lake. The final EIR has something that I just wanted to call out for people's review, which is that there were a lot of comments that were repetitive. And so rather than responding the same way over and over again, there's a set of master comments that were used. And those master comments are located right up front in the document. The document's 1,000 pages long, so it's a long document. But some of the common topics were the truck traffic and concern with road safety, greenhouse gas and energy, fish escape, fish health and biosecurity, the outfall, the effluent, the intake where the water is taken in for the use of the facility, fish feed, and then waste handling and disposal. There is a separate discussion just for each one of those at the beginning of the document so that it gives a good comprehensive analysis of those. That really concludes the things that I wanted to present. I just wanted to give the board and the public a quick update about where this is. The FEIR is available to repeat that, and then it is going to the Planning Commission to start the public hearing process on July 28th. Be happy to answer any questions that you might have. And then secondarily, there has been, the company has been in the news recently with a change in leadership. And Brenda Chandler, the interim CEO, of Nordic is here this morning and is actually here in the board chambers if you want to give her an opportunity to maybe come up and say hello and introduce herself.
Thank you, Director Ford. I think that'd be an excellent idea. And then I'm sure the board will have some questions. Welcome.
Thank you. Good morning, supervisors. Thank you for having me. Just a moment of introducing myself. I've been with the company since 2019. I was hired as their CFO. So essentially all the while, the California project has been ongoing. I've kind of been behind the scenes. You may have seen in the news our leadership has changed. Eric Heim and Marianne Ness, who you may have worked with or seen or talked with in the past, has left the company, and I've been named the interim CEO. Still getting up to speed on many of the aspects for California. I have a great team, though, behind me, those that have been working through the FEIR process and all the other permitting that are required for the fish farm to proceed. So just wanted to thank everybody up to this point, and we plan on continuing. And with the great team, in the great community, and with all of the help that we've received so far.
Hey, thank you, Brenda. Any questions for Brenda? Supervisor Wilson?
I mean, I don't, as you know, the departure of the leadership, or the current, whatever, and then basically the shift in leadership has, you know, raised some questions from folks and making sure that there's continuity moving forward. Mm-hmm. And I just want to just ask the question is, how are you feeling about this? Like where, and where's the rest of the team, and how, you know, what can we be, can we be expecting any other changes, or is this mm-hmm. This is where we're at?
So we have one employee on the ground, has been here for basically 2 years, and he will continue to be here. His name is Scott Thompson. So he's been here and will continue. Actually, we had already hired a project leader, an executive VP of projects for both coasts, for the Belfast, Maine project, and the Samoa project as well. So actually, in this, I'll continue to be the face of the organization. I'll be working with various constituents, and so I'll continue to do that. But that project lead had already been in place essentially, and his name is Steve Sachs, and he has worked on some very large projects on the East Coast, and so essentially he sort of kind of, in terms of the more technical aspects of all of this, he basically picks up that leadership for the project management with Scott, our local person on the ground here. Our sort of heart of the RAS technology remains in place. That's with an organization in Denmark. We call them NAF Tech. They basically were a group of engineers that were hired. They actually had their own standalone business, and several years ago, we essentially pulled them into our organization. So that organization remains intact. So that's really the heart of how the RAS system functions. So that else is all there. And then we have done the permitting in Belfast, Maine. Maybe not exactly the same processes as in California, but we have a great team that's done this before on the East Coast. So really, it's all about essentially the leadership and the direction, and that basically falls to me. We have above me the organization that's in Norway is still intact as well. So essentially, the guts of the technical and ability and all of that, essentially project management, all of that remains intact.
I appreciate that. Thanks.
Any other questions for now? Supervisor Bone?
Yeah, and we still haven't broke ground in Belfast, right?
That's correct.
There's still technicalities. And it looks like they're coming to head at the same time.
Right.
They're running on the same path. Is with this change up, and maybe I was misled with the past management team, it sounded like they were part of the ownership group, and I guess maybe they weren't, or maybe I just misunderstood. But you're going to venture into two 750,000 square, well, 500,000 to 750,000 square foot facility under roof. Financing and I don't know how, in Norway you have one facility?
In Norway, yes, we built.
And how big is that one?
That produces 1,000 metric tons a year of salmon.
And this
So
one
this-
is going to
Right.
provide 76?
No, more like 23,000 metric tons, 25 metric tons
Okay.
here. The difference is, and the way to think about this is sort of how you scale it. So yes, these projects are much larger, but they're modular. So if you think about how they sort of, you're
Yeah, you're
taking the technology and you're basically
You're
duplicating
going to
it.
operate out as you, as to pay for
Yeah.
pay for the expansion.
Right.
Yeah, well, I love the program. There's a few things I'd like to see change, but overall, I think
Okay.
the program's a great idea, and I think I'm pretty well known what those things are, so. But anyway.
And to
I think it's
clarify-
great. I hope we can, I hope we as a county, I know we're in great hands with John Ford, and I was kind of hoping I'd see Cade McNamara here today, who's been, I know, working his tail off on this EIR, so. Good luck.
Thank you very much.
Any other questions? Well, if we think of anything, we're not shy to ask you back
No
up.
worries. I'm here to answer them.
All right.
Thank you.
And actually, looks like is there one coming from Supervisor Wilson? Oh, okay. Lynette, did you want to speak as part of the team here? Yeah. Yeah. Since you're part of the company.
Thank you.
Right, thank you. Or part of the project, I should say.
So I'm Lynette Mullen. I think everybody here knows me. I just wanted to add on to what Brenda was saying and address maybe a little further Supervisor Wilson's question. So yes, Nordic has had a full-time employee here on the ground for a couple of years now, but Nordic has also been working very closely with both SHN and GHD. So those teams have also, those are local employees here that have also been working intimately with the project really since the beginning, since they started the permitting process. Those teams are also still in place. So I think it's just important for people to know that the team working on this project has been mixed kind of on both coasts from the beginning. And so the changes really aren't as drastic as people might have thought with the leadership change. Really, the people on the ground doing the work are still here. The other thing that I think is important for people to know is that a lot of the agreements that have been put in place in the last couple of years, working with the environmental groups, addressing their concerns about energy use, that sort of thing, even transportation planning. You know, there were a lot of folks that were worried about the truck traffic and emissions and that sort of thing. All those things really are in the EIR. So the fact that leadership has changed in Humboldt doesn't mean any of those things have changed. Those things are a part of the project. And so I just wanted to add those as well. Thank you.
Great, thank you. If you are on the phone and you wish to comment on this item, be sure to press *9 now so we know. I think we'll go to those in the public who wish to comment who are in person. Welcome.
Ken Sawatsky, I very strongly have supported this project all the way along with Jeff Hunterlock and the jobs it may create for us, our need for our jobs and our need to repurpose our infrastructure in that particular facility seems to be being well served. I did want to do a little bit of a shout out that Ms. Mullen and I have been communicating frequently. It's been a pleasure working with her as far as a liaison, and I wish their new interim CEO to understand how big a part Lynette has been in developing confidence with a lot of us. I mean, a lot of people were going directly to the two people who have left. She's still here. And as John Ford very wisely said, this is a project that's being permitted. It's not people being permitted, and I appreciate that particular concept. I also wish to shout out very strongly for what John Ford did and Nordic's willingness to do a full EIR. That was something that should have eliminated a lot of the potential problems that some people may be bringing forward now. And I hope that the people who in the environmental community or anybody who has concerns show up at that planning commission meeting and have their say. Because if they wait And my understanding is they can say the same things they would be saying to the Coastal Commission at that time. They can speak on those topics. But if their intent is to go ahead and throw monkey wrenches in this project when it gets to the Coastal Commission level, I have a lot of angst with that. I think it's disingenuous. I think they should be at this meeting expressing their concerns, and those concerns should be dealt with at that time here on out. There's kind of a rumor that there may be some backdoor deal trying to make all kinds of changes at the Coastal Commission. I hope that rumor is not true, because that will not bode well as far as my perception of the environmental community. And I think everybody should be right out front and deal with this at this upcoming meeting. Appreciate our opportunity to speak at that meeting, and I appreciate the manner in which Nordic has been responsive, their outreach, and their ability to communicate with everybody, I think has been, I can't think of a better project where I've seen better outreach and going that extra 9 miles to make sure a project satisfies the desires and needs of the people out there. So hopefully this will move through smoothly. Look forward to the meeting, look forward to hearing any complaints anybody has at that time. If I attend the Coastal Commission meeting and they have new ones, I will not be happy with them, and I will make that quite clear. Thank you for my opportunity to speak today.
All right, thank you. So we will go to those on the phone. We have 0116. Just press *6.
Hello, can you hear me?
Yes, welcome.
Hello, this is Ash Teeter. Like previously when this was heard at the Planning Commission, I had asked and was given the answer that the fish are not genetically modified. But one question I had did not get answered is whether some of the vaccines used for the fish, if any of those vaccines use the new mRNA gene modification tools seen like in the COVID vaccines. So I was wondering if that could be answered.
All right, well, then we go back to the board.
That's it. That's it. Thank you.
Okay, thank you. I don't see any other hands up. So we can go back to the board. I don't know if there's any Supervisor Madrone.
Thank you, Chair. Yeah, I was hoping, Director Ford, that you could maybe run us through what the logical steps are going to be at this point. I mean, obviously, the draft EIR is being commented on and responded to. The final EIR is coming to the Planning Commission on the 28th, theoretically. Then what? Where do we go from there?
Thank you for the question, Supervisor Madrone. So the actual coastal development permit can be approved entirely by the Planning Commission. But it can also be appealed. And it can be appealed to the Board of Supervisors and or to the Coastal Commission. And so there's a little bit of uncertainty there in terms of what an opponent may want to do. We don't know that there's opponents who will appeal at this point. But those are the two options that would be available from that. If it's approved at the Planning Commission level, then the permitting from that point out would be the intake and the outfall would be permitted at the Coastal Commission level. That outfall and a certain component of the intake will have consideration with the NPDES permit issued by the Regional Water Quality Control Board. It's my understanding that the Department of Fish and Wildlife is currently working on the permit for, or the license, I guess, for the species, which is currently Atlantic salmon. We don't have a formal answer on that at this time.
So that if it's approved by the Planning Commission, it could be appealed to the Board of Supervisors or the Coastal Commission?
That is correct.
And or if it's denied, either way, whether it's approved or denied, it could be appealed to either place.
Correct. And it could be appealed to the board and then to the Coastal Commission too.
That's the third option of how things could go. All right, appreciate that. Thank you.
Mm-hmm.
Supervisor Bushnell.
Thank you, through the chair. So if it is appealed to the Board of Supervisors and is approved, and then it's appealed to the Planning or the Coastal Commission and is denied, what happens?
That would be a denial.
So they supersede? Okay.
Yeah.
So that's one of the reasons that they may choose to go straight to the Coastal Commission, I would suspect. I mean, it's an option.
Well, the reason that there's an appeal directly to the Coastal Commission is because in Humboldt County, we do charge $1,600 for an appeal. We don't cover the cost in that $1,600 of an appeal. But the appeal to the Coastal Commission is free.
I just learned that. Thank you. Supervisor Madrone?
Yeah, thanks for the responses. You know, I want to commend Nordic for having from day one, literally, worked really hard to be responsive to the community. I remember the first time they came before us and we were talking about things like worker, you know, right to work, prevailing wages, living wage jobs, things like that. And Nordic was very responsive to that right out of the gate. Thank you for that. And in addition, with all the issues that have come up, I agree, you know, it's really nice when folks, if they do have concerns or issues, they bring them forth early in the process and give the applicants the opportunity to respond. From what I've seen, Nordic has worked really hard to try and meet all those. I know there still are some concerns out there, and I suspect that we'll continue to work on trying to respond to those, mitigate for those, and work through all of those. But I want to commend the community and Nordic for being both very forthright in terms of coming to the table with the concerns so that we can all, you know, try and figure those out. So anyway, thank you for that approach.
Any other questions? All right, is there a motion to accept the report?
I'll make a motion to accept the report.
Second.
All right, a motion has been seconded. Supervisor Wilson, is your computer back up? No, it's not. Okay, roll call vote, it sounds like.
Okay, Supervisor Bone?
Yep.
Supervisor Bushnell?
Yes.
Supervisor Wilson?
Affirmative.
Supervisor Bass?
Yes.
And Supervisor Madrone?
Yes.
Thank you. Motion passes 5-0.
All right, thank you. We'll move on to our two items that are initiated by board members. The first comes to us from Supervisor Wilson, and it's regarding a letter of support for SB 1256. So Supervisor Wilson, I'll hand this over to you.
Thank you. And this, I mean, I'm hoping this is relatively simple. Basically, there's legislation to phase out single-use propane cylinders of the 1 gallon and size. Basically, that's what we typically see, you know, in camping and those sorts of things, and basically moving that to a refillable. It's become a, you know, pretty significant issue in parks as well as in our waste stream. And it's a completely doable technology, and they already produce these canisters that are refillable. There's already refilling locations. There's, I think, at least one, if not two, in Humboldt County already. And this phases in. Doesn't take effect until 2028, so it allows for that transition to occur. We don't really have anything in our legislative update, so that's why I'm bringing it to the board. And that's the simple request, and if they have any questions, I'm happy to answer them.
Supervisor Madrone.
I would move approval of the letter of support.
And I'll second it.
And Supervisor Bushnell.
Can I just, Mike, or Supervisor Wilson, do you know the expense for the refillable ones comparable to the little green ones?
They are a bit more. I think I purchased one a while back. I think it was like $4 or $5 more. And then the refill, you got to find a place to refill it. I think right now the only place that I know of that for surely is U-Haul in Eureka. I think the new outdoor store, or whatever its current version does now. But again, it takes 5 years to take effect, and so we'll move in that direction. And it is a pretty significant issue, because the problem is like when people receive these in the waste stream, they don't know if there's still gas in them. And so it's just been a real pain in the butt. Yeah. And then how do you recycle them? And they're just in our waste stream, this is probably one of the more problematic issues that we have.
So I'm curious, the filling stations, how in other areas have you investigated the filling stations and how easily they would be able to be implemented, say, in my district where obviously there isn't any?
Well, I don't know if there isn't any currently. I mean,
There isn't any
okay.
currently.
So, well, like I said, sporting goods stores generally are the places that are talking about updating these things, and then sort of larger grocery stores and those places that would be selling these products. But again, there's 5 years to make that transition. So
I'm supportive of it. However, you know, I don't want someone from my district have to drive to Eureka to get it filled and not have any availability in this in the more rural areas.
I don't want that to happen either.
I am sure you don't.
So, but nonetheless, this is the you know, sometimes it takes legislation to move us in a certain direction, and I believe this is reasonable.
Okay. Supervisor Bone?
Well, I think, and I'm sure Supervisor Wilson knows this, they're also moving forward, so you'll be able to refill these out of your own 5-gallon can, so you can refill. So you're going to take your 5 and go fill it, and then you're going to transfer it just like you do a lot of other airsoft guns or whatever they are and stuff like that. So that's kind of what the 5 years is, from what I understand. And I've talked to a few of the people that are, it's actually will help quite a bit on a few of the issues with the homemade, the illegal substance that's used for the 1-gallon canisters too. So because they get pallets of it in some of these stores downtown, which is amazing. So I think, but what they're going to do is there'll be small refillables off your 5-gallon, your 10-gallon, whatever you want. And so it won't be that big. In 5 years, I don't think it's going to be that big a deal.
There you go. Appreciate the additional information.
Well, and perhaps maybe, well, if we were to do a different letter and put something in, you know, availability throughout the entire county, but I think 5 years does give the opportunity to work towards that. Is there anyone in the public here? And if you are listening at home, please press *9 if you, *9 to raise your hand if you wish to speak. Welcome.
Ken Sawowski, I strongly support this. I think I actually have never used it, but I got that little attachment that'll go from 5 to the other ones from Harbor Freight for something like $12 or something back in the day. So I don't think the technology seems to be there, and I have no problem with that. It totally makes sense to get that out of the stream. And just the fact that, you know, you might blow someone's hands off trying to handle the thing is pretty scary, you know, when you have a toxic thing like that ending up in the stream. So anything with partial gas in there and someone accidentally gets it in something or does something to, or causes damage to equipment or anything is a concern. So, yeah, I strongly support moving forward with this. I really wish you'd have a little something more here on getting a little more emphasis on getting the recyclables back in the stream a little bit also. This is important also, but I know I'm a little off topic here, but maybe sometime we can get that, unless Humboldt Waste Management is decommissioning their ability to recycle. We really need to work on that also. So maybe we can get a letter coming forward to try and even have our local people take that back on. Thank you for my opportunity to speak.
All right, thank you. We'll go to those on the phone. We have 0116. Just press *6.
Hello, can you hear me?
Yes.
Yeah, it's camping season, and like my wife was actually looking into one of those attachments, because I'm not sure if like the refill attachments, like from what she was saying, the one she was looking at like might actually refill the green ones too. But I'm just wondering, like with the new reusable ones, like people will, you know, some people are lazy and will probably could just go to dispose of those too. So is there like any like indicator or something on the outside that shows how much gas is in those, or what's really different about them that you can, you know, safely dispose of them and see how much gas is in them? That's it. Thanks.
All right, thank you. And there are no other hands up, and I'm sure there'll be questions as this moves forward. So Supervisor Wilson?
I'm prepared to vote.
All right, we have a motion and a second. Nikki, can we have a vote, please?
Absolutely. Supervisor Madrone?
Yes.
Supervisor Bass?
Yes.
Supervisor Wilson?
Yep.
Supervisor Bushnell?
Yes.
And Supervisor Bone?
Sure.
Thank you. Motion passes 5-0.
All right, thank you. And so we'll move on to the next one, which I actually put on the agenda, and it's regarding the appointment of the county delegate and county alternate to participate in the National Association of Counties Conference, election of officers and policy adoption next week at the conference. So normally in the past, we've had the member and the alternate, whoever is there. It's usually the member from our board that is the voting member, but we thought we should just bring it and do an official, because I'm not sure if anyone else is going besides myself and Supervisor Bone. So anyone else on this board planning to attend?
I will not be going to Denver in the end of the month.
So perhaps we can have a motion to appoint Supervisor Bone as the voting delegate, and I'll go as the alternate?
So moved.
Second.
Okay, thank you. And anyone in the audience care to comment on this item? All right, online, is there anyone that wishes to comment? Does not appear to be so. All right, Nikki, can we have a roll call vote, please?
You're going to vote for Gore, right?
Break his kneecaps.
I don't think I publicly announced who I'm going to vote for ever anyway.
Okay, well, I'm putting
Just so
in
you're
my.
aware.
I'll put in my.
Your preference?
My preference.
That's fine.
Okay, thanks.
Yeah, I was going to put my name in, but I figured it's all right, I think Nikki.
Sorry about that. Okay, Supervisor Bone.
Sure.
Supervisor Bushnell?
Yes.
Supervisor Wilson?
Yep.
Supervisor Bass?
Yes.
And Supervisor Madrone?
Yes.
Thank you. Motion passes 5-0.
All right, so next we will be going to our closed session items. And before I ask the county council to brief us on those, can we take a 10-minute break perhaps, or 15-minute break? Is that all right? I see our special guest did arrive. Give them a chance to get relaxing, settle in. So county council, 10:15? I mean 10:30. Okay, hold on. Right, Supervisor Bone wishes we don't take a break, so we'll go straight in. Well, you know this group, we always end up late. It's still going to be. How about a hard 10? Okay, hard 10. Let's just do that. And well, anyway, yes, county council.
Thank you, Chair Bass. It is the intention of the board to meet in closed session pursuant to California Government Code Sections 54954.5 and 54957 in order to consider the public employee performance evaluations for the positions of the County Administrative Officer and the Director of Planning and Building.
All right, thank you. And if you're on the phone, you wish to comment on this, be sure to press *9, but we will go to those in public first. Excuse me. Welcome, Kent.
Well, it's a pleasure for me to endorse and be able to endorse the continued position of John Ford being in the position of planning and building, and for you to evaluate him. I think he's been, although he and I may agree to disagree on many things philosophically, as far as his skill set, he does bring a skill set that's very necessary to this county. And I'm very pleased that he was given a compensation package that was sufficient to keep him here. I think especially with projects like Nordic and things going on, at that time we would have really been at a loss to lose him. And I'm not aware of you having anybody in the queue that I think could even come close to satisfying and fulfilling that position. You would have had to go outside the county as far as people I heard that were willing to take that and or had the skills. So I would like to do a shout out and thank John Ford. I think he's one of the more capable employees the county has, and I strongly supported what you did while I was gone in Mexico regarding keeping him here. Regarding your county administrative officer, I have no comment.
All right, thank you, Kent. And we'll go to those on the phone, which there are no hands up. So we'll go back to the board. I just say we're meeting at 10:30, so there you go. That's a hard 10:30 in closed session in the conference room. have to leave. He had an event he needed to get on the road for. But we'll have the public comment period now, 3 minutes per comment. I think we've got most of the folks who already know the process. So we'll start with those in person. If you are listening at home and you wish to comment, press star 9. I see a few hands going up. And so on our list, we have Charles listed first, followed by Genevieve, and then I'll write in Kent. Yeah.
My name is Charles Wilson.
Welcome, Charles. Oh, hold on just a moment here. I never turned it off. Oh, thank you very much. I'm going, I swear I didn't turn it off. We'll let you start over there.
Oh, okay. This is Charles Wilson. We people fought the British long ago, fought the British king to get our constitution, which limited the powers of central government, including the king, and specified that the rest were reserved for the states or for us common people. We've been protesting the COVID nonsense for 2 years now, since August. One sign says, "My body, my choice." One woman said, "I couldn't use that sign because it was only theirs." The North Coast Journal had an editorial cartoon which showed a scruffy, pot-bellied man with the same slogan, ridiculing the idea that the slogan could be used by anyone else to protest forced vaccination. Another My sign says, "Fear, Hitler, Stalin, Mao." You get the idea. In other words, the government's doing their thing there. One guy said, "Who is Mao?" I mean, it's hard to conceive that he had never heard of him. But anyway, he had never heard of the British dictator who killed some 32 million people and made a law saying that that after the first baby, women were forced to have an abortion. Girls were routinely aborted in preference to boys. I mean, the culture is the way it is. China now has 36 million guys who can't find a Chinese wife. They killed all the girls. It's simple logic. If central government has the power to dictate whether you can have an abortion, then it also has the same power to force you to have an abortion. Government has lots of popular political reasons. There's climate change guilt, population explosion, genocide, etc. It'll find something. The gullible say it could never happen, but why not? Many people already believe we have a democracy ruled by the majority vote, instead of 50 constitutional republics or little countries with limited powers. If the mob majority votes to have forced abortions, central government won't stop them. Thank you.
All right, thank you, Charles. And next we have Genevieve and then Kent. And for those of you who may be waiting for a report out of closed session, we're still in closed session, so we'll be reporting later this afternoon. Okay, welcome.
Okay, thank you. This is Genevieve Wilson. According to the news, I'm always talk about current situation. 70,000 of independent trucker, they're going to subject to new law. That's kind of bad. You know, my point, we don't have our freedom, we have no choice. And also 60,000 of Coast Guard, they resigned because of whatever the jab they want to give it to us. And this is wrong. By the way, and then they talk about the abortion situation. Now they're going to building a big abortion clinic by Oakland. And according to that people can come to our state to have abortion, but our tax money is going to pay for it. And that is wrong. By the way, abortion, I always say, is your woman, you have to be surgically cut because of the not cautious with your sexual behavior. And that is wrong too. That is not feminism. According to our Constitution, we all have the life, liberty, and pursuit of happiness. So you don't even have a way to choose what your life is. That's no, it's not your freedom. That's why we need to really pursue that. In our lifetime, we go out with a bang with the 4th of July, everybody open, and now they are scaring you about the Omicron or whatever is going very contagious, monkeypox. Hey, come on. Do we see the past experience? So you study the history, you learn from what happened to the past. Is it doing anything good? So, and live for the moment. Future, we all really don't know, correct? So but you have to be cautious. Think about your future. You don't put anything in your body to affect you. And take your vitamin C, D, and zinc, plenty of fluid, and sleep. And that's it. And then also, you heard about the shopping show. They talk about pickle pancake. So I say, don't let government pickle your brain and think openly. And I sing my freedom song. But today I have a different song. This is called Corona Fear. They're coming up for us. So you have to remember that. And you have copy. Genevieve Corona song. I composed it in when the last lockdown. Be not afraid, with Jehovah by your side. Treat mankind with love in your mind. The hard time will go by. Fasting every other day, you will not be starving. At the end of the time, you think you will be amazing. With house arrest every night, having fun night after night. Live one day at a time, the hard time will go by. As long as you have Jehovah by your side. One last thing, when the pro-choice people, I hand them a constitutional book. He throw across my head, and he's a transgender. Then she said, I pick it up. I said, give it back to me. I said, no, I am not giving it back to you. You disgrace our Constitution. He might tore it up. Come on, wake up. Communism's coming. Our Constitution, we have to protect that. So thank you.
Right, thank you, Genevieve. Welcome.
Ken Sawatsky, it was Philip Smith Haynes, I believe, who always said, have a prop to do when you're speaking. So I found these fish today, and I have a saying I go by. I won't give you these fish, but I will be happy to try and teach you how to fish. That's something very important to learn in life. These go down to Mexico. I have a wonderful place to hang them in an entranceway with a whole bunch of artifacts from the indigenous people. So I showed you this a little earlier, and this I bought locally here also. And remember my friend passed a while ago, and when I walked and showed him this, he said, can I keep that till I go? And for him, it was very important. He kept it in a prominent place, and the dead kind of sense things, I think, are the soon to be dead that we don't, and he found this to be a sacred thing, and to me, it was his gateway to the next land. So to me, it's important also. And it represents karma. And so now I'm going to start something. It's going to be a trial in the court of public opinion, and it's a little surreal. But I think Steve Madrone knows where I believe where the karma bank for the whole world is, and it's in the Suzy-Q area, across from an Indian village, right across from a sweat lodge, on the north bank of the Trinity. I see that's the International Karma Bank. So if somebody has something to dispute that, I'd be happy to hear it. I don't think anybody can, but I find this a sacred place for me, and I go there. Part of what I found is that, well, let's just do a little bit here. We'll start the trial. So the judge, the jury, and the executioner is one person. It's Mother Nature, and she's the one who actually does judge us all. And she does her court a little different. She comes out and she announces the sentencing before the trial. And the sentencing is very stiff. And 3 minutes at a time, I will be bringing reasons why certain people will be sentenced. I just want to let you know, Steve Madrone has so many karma credits in that karma bank, he's already exempt. Others of you don't. This basically comes out, and I humbly have to give the verdict first. The verdict is guilty, and the sentencing is 30 to 50 years to life of bad karma. And that's a horrendous sentence. I mean, you have to do something really, really bad to get that kind of sentence. I mean, some people say, give me something else. I don't even want to live through that. But when certain boundaries are crossed and certain people are not protected, especially the young children, especially when they're left in homes where they continue to be molested and raped, and you have to have a state attorney general make you go ahead and do what's right, then the line's been crossed. And this is just one example. There'll be a whole bunch of other ones. Negative karma are things like such are what happened to the quote-unquote Great Redwood Trail. So I'll have a time to explain to you a little bit at a time, and I'll bring witnesses in, which I will speak for, and we'll have an interesting time, 3 minutes at a time in the future. So thank you for my time to speak on karma.
All right, thank you. So now we'll go to those who are on the phone, and that'll be 0116 followed by 0150. Press *6 to unmute. We'll go with there you go. Well, welcome, Ash.
Hello, can you hear me?
Yes, welcome, Ash.
Okay, yeah, and I just wanted to touch kind of a lot on what Chuck was talking about before, just the whole relying on the course set by central governments, world governments, all that, when we should be paying attention to local stuff. Here you go.
Hunter joining the then Vice President on the
Yeah, also what Genevieve was talking about with the truckers and stuff, that kind of brings up a lot with like our whole food crisis that we're going through. I don't know if you've heard about all the food processing plants that have been shutting down. Big thing. And then also just the whole electric vehicle thing. I don't know if anybody here has been in a long line at the gas station, but just try and imagine that, except when people are in electric vehicles and they have to charge for 3 to 4 hours at a time. And also in Southern California, there's recently a fire for an electric vehicle charging overnight, and it's common that when this happens, they can't be extinguished for up to 48 hours. So they're recommending that people don't charge their vehicles overnight in their homes, and that they watch them the whole time. So what are people going to do when they have to supervise their vehicles being charged the whole time? I mean, it's kind of ridiculous. Anyways, that's all I got. Thanks a lot. Have a nice day.
All right. Thank you, Ash. And then we have 0150. Press *6 to unmute. Welcome.
Good afternoon. This is Dottie from Southern Humboldt. And I wanted to bring up two things, which I'm sure I could bring up lots more, but I'll start with these two and see how it goes. One is we need an Avenue of the Giant plan. We've been here for 22 years, and we've never been invited to a meeting on an Avenue of the Giant plan. So many of you in your district, and if not in your district, are influenced by the Avenue of the Giants, and we need a plan. And along with that plan, we have to figure out what's going to happen, where we're headed with it, what the plan is, and where the resources are going to come. So I encourage every single one of you on the board and anybody that's not here today on the board to get together and very soon come up with a plan. Now is the time for a plan to be activated, started, because there's lots of change, and the change is either going to go in one direction or an entirely different direction. And it's really up to you, this board, to determine what their priorities are and what their interests are in supporting it, because this plan is really your plan. And we hope that you can come up with something with many of us that want to have a community building block grant to get together and talk about how do we really make the best out of this most amazing way of traveling through the Redwoods. So we can't just forget it and abuse it by not addressing it. It's ours, all of ours, and we need to take care of it just like you would, as Kent would say, taking care of a child so that they're not abused. The Avenue of the Giants is abused. The plan is not getting what it deserves, and so let's put that in place. The other thing is that this lien on the Christian Science Church property is an ongoing drama, and the drama now is that the hospital wants to take it as an eminent domain for less than half what the value is, which is not what an eminent domain is supposed to do. So instead of fighting over that and creating more fighting over whatever fighting there is, let's get together. We need to have some help reducing the amount of the lien so that we can effectively sell it. Should the hospital have it, or according to the lawyer that's representing the eminent domain for the hospital, they still said the best use of this property is for housing. So whether it's housing for the hospital or housing.
Well, hold on
Yeah.
a minute, Dottie. I'm going to let you finish your last sentence. The timer ended up that did not ding either time. So if you want to finish like that last thought, definitely please go ahead with that. But I wanted to let you know it's been 3 minutes, but the sound did not make. Yeah, sorry about that.
Okay. Yeah. So anyway, so we need to all work together on this. I mean, I'm not going to fight about this. We just need to have the appropriate money coming in the direction of the Christian Science Church so they can rebuild a church, and the county has to be part of whether
Thank
it's the
you,
best
Dottie.
use.
I said just a few seconds because you had a little extra there. And the timer went off way after. So we'll fix that by next week. Kent, I think you wanted to know what the technical thing was going to be today. That was it, apparently. Yeah, so we're going to be going back into our closed session, and we'll be back in a while. Half an hour, probably. Yeah, we're guessing around a half an hour. You know how good we are at guessing, though, so.
Hey, Michelle, thank you for the picture. You can send it to me.
Council, may we have our Deputy County Counsel Miles, may we have a report out of closed session?
There is no reportable action taken at today's closed session.
Wow, what a surprise. No, I'm sorry. All right, then we are adjourned.